Good morning. Welcome to our Basic Life Support practical training course, which is coming to you via video. My name is John Williamson. I am the clinical lead and trainer for Atlantis Medical Limited. I hope you're well and relaxed and comfortable at home with your family and your friends. Now, I will normally teach this in a class session, and because of the public health issue concerns, we will be doing that to you by video. So, for this topic, we will be looking at what actions to take in the event of an emergency occurring at your place of work. We'll be looking at cardiopulmonary resuscitation methods, including the use of an AED. We'll provide first aid. We'll learn how to provide first aid to an unconscious casualty, providing first aid to a choking casualty, describing what actions to take with regard to control of wounds and bleeding, and what actions to take with regard to a range of other first aid situations. So, to begin with, let's look at what first aid is. Now, take a few minutes to look at those two words, first and aid. So you are the first person who's arrived on the scene, and there are three people on the floor. One is lying down, obviously unconscious, not very responsive. Another one is in a lot of pain from having broken something, fractured something. It's obvious that they are not able to move. And then there is a third person who is bleeding a lot. So this is where the first aider's classic dilemma comes. Who do I respond to first? Now, the way we make such decisions is based on whose life is at the most risk. Now, we don't know a lot about these three casualties, or the presumption is that we do not know a lot about them. So we are going by the fact that when somebody is being assessed as to treatment-wise, we will look at how responsive they are. So that is why we will define first aid in terms of A, preserving life. That is paramount. That is very important. First aid, the most important function of first aid, the first function of first aid is to preserve life. So you are going to ask yourself, whose life is in the most danger based on your assessment of the situation. Now, the other thing first aid does is it will prevent this condition from deteriorating. So you are going to be thinking, once I have attended to this person and I have made sure that at least their life has been preserved, I need to think of whose condition is likely to deteriorate the most quickly. And that's when we will look at the third, but not the least, but in this case, the last in the triage, in the priority, is for eventual recovery. For someone, the case is more to do with helping facilitate eventual recovery. So that's the gist of why we have the definition of first aid, which is the care given to a casualty before professional help arrives. And the aims are to preserve life, to prevent the worsening of any injuries, and to promote recovery. So now we are going to look at the sequence of steps, what we will do in the preserving of life. And so back to our accident scene, you first of all have to look at the environment. It's great that you are first aid trained. It's great that you want to intervene, you want to do something, and you must. It's a responsible thing to do. But the last thing you need, or anybody need, or even the casualties need, it's for you to become a casualty in the process of assisting somebody, which is why you will need to follow the sequence, the principles, the precepts of a first aider. And it is doctors A, B, C. And we'll go into more detail about that in the next clip.